Hi, guys. We're going to go ahead and work on the next topic that we're coming to on um, observational studies and experiments. Now, we haven't talked about that vocabulary yet. I just said, hey, read these articles. Okay, so let's take a look at what we came up with. We'll actually go back to these articles in just a second. So here's the first one, which was the article that had to do with the surgery for the osteoarthritis, laparoscopic surgery for the knee. Okay, and dealing with that pain. And so they ended up doing a placebo surgery, which is really interesting. Now, let's go to the next page and talk about some of those things. I had asked you to kind of fill out some of these items as you go through that. Just kind of curious what or if any you knew about these kind of vocabulary words, but we're going to go ahead and dress that down here. So let's do that. Let's do that first, and then we'll go back up there. Okay. So the first thing, the first question asks who are the subjects or the experimental units. Okay. So if we take a look at our vocabulary down here, then our experimental units or our subjects, okay, so those are the items, whether they're living or not. If they're tomato plants, in this case, they were um, people who suffered from the osteoarthritis pain of the knee, okay, whether they were living or not, on which the study is being performed, okay? So we'll go ahead and tap that in here on this top part. So here we go. All right, here we go. So the ones that we had actually in your article, okay? So those were the 180 patients with knee pain. I had said it kind of in the third paragraph. Said it at the very first of the third paragraph. Okay. All right. What are the treatments? So what do you think that means? Treatments. Well, let's take a look down here and see what we have going on. So treatment is what was being administered to those subjects. A lot of times that'll also be considered this explanatory variable. So the treatments are the things we are wondering if are the cause or explaining the response that we're going to measure. Okay, so explanatory variable is that variable that explains the outcome. If you were doing algebra, and later when we get into bivariate data, it's most often that x variable or that independent one. Okay, and then we'll be talking about that response that we'll be measuring. And so we'll talk about what was it that we were measuring with these particular subjects in this situation. So measure the outcome of the study. That's that y variable, dependent variable. Okay. All right, but taking a look at these treatments, something that is administered to the subjects. So what was being administered? Okay, so if we went back and we looked at the study, let's see here. It says also in that same third paragraph, it says one group received the debridement, okay, in which worn, torn, or loose cartilage was cut away. Okay, so that kind of told you what that was. All right, with the aid of that pencil thin viewing tube. All right, the second group had what was called arthroscopic lavage. Okay, and so that was where they actually just used liquid or water and put it in that area to wash away any debris that was in there, like cartilage that had come off or anything like that. Okay, and then the last uh, group was they went through a simulated surgery. So this was actually the placebo surgery. Okay, so those are the three different groups. And so this placebo we'll talk about in a second was a fake surgery. Okay, so if we come on down here, let's talk about two other kind of components to treatments. A factor means the variable or the type of thing that's being administered. Okay. In this case, there was one factor, surgery. Okay. And in our case, there were three levels: the debridement, lavage, and the placebo. Okay. Another way to think of it is factor, the type of the thing that was being administered in this case, or in another case, say maybe it's another type of medicine. Maybe they're giving a type of omega-3 fish oil. Okay. And then the levels would be the various measurements of that. Okay. So the 0 grams, 15 grams, or milligrams, or however they do those measurements, 30 milligrams or grams. Okay. So that's the factors. So factors is how many kinds of things are you assigning to the subjects? Okay. If you assigned them a type of omega-3 fish oil, and then you also assigned them a particular exercise regimen, okay, then that would be two factors. Okay. And so, say the medicine would have the three levels of 0, 15, 30. And then maybe you had the exercise regimens, you had two different kinds, 30 minutes of walking 30 minutes a day versus walking an hour all day. Okay. All right, so that's those things there. Now let's go on up here and see if we can't answer the rest of these questions. Why do you think people would volunteer for this? That's interesting, knowing that they might not actually receive the treatment. I don't even know if it addressed it here, but it did talk about they had a really strong ethical review board that talked about how to do this in a stringent consent process. In fact, it said that the people had to, on entering the study or before they went into the surgery, they had to write in their own handwriting, that I realize I may be getting the placebo surgery and that this means that I will not have surgery on my knee joint and so on and so forth. And it would not improve or not benefit my arthritis to my knee. Okay, why do you think this might happen? Well, I was wondering, are they going to have free medical care? I don't know. That could be an incentive, okay? Um, so maybe that's the big one. And say they were getting the placebo, and then later it was found out that the one of the other kinds worked, then I bet you that they would, negotiate so that if we have another kind that is working and is proven to work, we'll give you that for free. Okay? Maybe they're getting money, you know? Sometimes people do that, money to be in that. I've seen that kind of thing happen to be in a study. All right. What conclusion was made from these results? This is interesting. Crazy interesting. Okay. So let me see here. So I'm looking at about looking at the paragraph under the one that says of the 324 pages. So during the 2 years of the follow-up, the patients in all three groups reported moderate pain improvement in pain and ability to function. Okay, so that's what response they were measuring. So that's the response variable that they were measuring, by the way. Okay, so here were the results. However, neither the intervention group, so neither the debridement and lavage, nor the placebo, okay, let's see where I just lost it, reported less pain or better function than the placebo group. Okay, so the debridement and lavage did not report better results than the placebo. Crazy, 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 crazy. So they're saying in an effect, in a sense, that this response, the reduced pain that they were measuring could have been what's called a placebo effect. People just thinking that their pain was less because they had the surgery. So what conclusion was made? That the debridement and lavage did not um, improve pain or function of the knee significantly. Might have been a little bit, and that can happen. And we'll talk about that because of sampling variability, but it wasn't significantly better, okay, than the placebo. All right. Who do you think these findings can be generalized to? So this is interesting. We're going to learn about this in the next section when we talk about the scope of the studies. So technically speaking, we can only generalize to these volunteers. Okay, we can't generalize to all such knee pain sufferers. Um, these volunteers might have been more desperate. These volunteers might have been more anxious to have some kind of improvement. These volunteers might be more regimented with their improvement processes and physical therapy and those kinds of things. So we can't necessarily generalize to everybody because the just the people who are like these volunteers or these volunteers. Okay, so interesting, and we'll get more into that in a little bit. Let's see, did we go through all of our definitions here? Okay, a control group. Okay, so that control group, and we had one in this case, is that group that was given no treatment or the current treatment in use. Okay, so they can be the control and still get something. So, like an example, no medicine or the current ointment on the market. Okay, for example, if you're have a patient who has high blood pressure and you want to check out a new and improved medicine, you are not going to say, oh, guess what? Psh, you got to stop your medicine and we'll give you no medicine or this new one we're trying out. No, the control group could be the medicine that's currently on the market. So they continue to take that. And then we introduce this other option and see if people have significantly better response to that than the current one. So the current would be considered the control, the starting point, the baseline. Okay. And then, of course, we have that placebo, which we've talked about, that fake or sham treatment that looks and feels the same as the actual. So typically used, and so this is important. You don't always need a placebo. If I'm just measuring something like the length of my fingernails, okay, that's a physically measurable amount. I cannot think to myself, fingernails grow, fingernails grow, fingernails grow. That I have no mind control over that. So, me thinking about putting medicine on my fingernails or whatever isn't going to make them grow longer. Okay. Typically, you use this placebo if there's some kind of psychological response you're measuring, like pain. In this case, people thought, ooh, you know what? I'm getting a surgery. So I think that's going to make my knee better. Okay, so did that's the kind of thing where you need to take out that placebo effect of improvement psychologically because you think you're taking a medicine or you think you're taking a treatment that will have an impact. Okay, now this is interesting. In experiments, you have these things called single blind or double blind, and you don't always need these again, but suppose in this case, the patient, okay, so in this case, the patient did not know, and they wrote on that thing if they were receiving the placebo surgery, the debridement, or the lavage. Okay, so that would be called single blind if only the subjects are unaware. So the subjects did not know which treatment they got. Okay, now if the surgeon also did not know, or you know what, in this case, maybe the doctors who asked them about how they're feeling, or the physical therapists who asked them about their progress, that kind of thing. If those evaluators do not know which treatment that person got as well, that's called double blind. So single blind for just the subject, double blind if also that doctor. Now, let me tell you something. Somebody knows. It's not like nobody anywhere knows and it's a mystery. No, like you have that lab technician somewhere who's going to match up the number systems together and see who knows. Okay? Now, let's talk about this double blind thing. Why might that be something you want to bring into this study? Say it's the physical therapists who do not know what um, what the type of surgery the patient went through. Okay, why might we not let the physical therapist know? Okay, do you think if the physical therapist knew you were having just the placebo surgery and were like, they knew in their mind, oh, pfft, That was just a placebo surgery. It was just a little cut. They didn't have anything real invasive. So I'm going to be more rigorous on their physical therapy because I know they should be able to handle it, or whatever. So, and they may not even consciously make those decisions, but they could, So you might have it double blinded. So even that person who interacts with the patient is not giving them a signal or leading them to, have certain results. Okay. So that would be the purpose of that double blind. All right. So I think I'm going to actually just kind of cut this video on this one, and then we'll go to the next discussion of the the one with the coffee and the skin cancer. So interesting, which is about observational studies. See, here, this is called an official experiment, and we'll talk about why it's officially called an experiment versus this thing called an observational study. An observational study, we'll talk about that in just a minute, okay?